Let's talk about knee pain. It's something that affects so many people, and it can turn the simplest things you do every day into a huge struggle. But what if getting relief didn't automatically mean surgery? Well, today, we're going to dive into a complete guide on how to heal your knee pain without ever going under the knife.
Man, this quote just says it all, doesn't it? I mean, whether it's just trying to climb a flight of stairs, walk to the corner store, or even just getting out of bed in the morning, that sharp, nagging pain can totally take over your life.
So that's the big question, right? Is surgery really the only way out? Well, the great news is that for a lot of us, the answer is a huge, emphatic no.
All right, so here's our game plan. We're going to start by figuring out why your knees are hurting in the first place. Then we'll walk through everything from simple at-home fixes to more advanced treatments. And, super importantly, we'll wrap up by talking about the signs that mean it's definitely time to see a doctor.
Okay, first things first. If we want to solve the mystery of your knee pain, we have to play detective and understand the clues. So let's break down the most common reasons your knees might be sending you those not-so-subtle pain signals.
So the usual suspects usually fall into one of these 5 categories. You've got arthritis, which is that classic wear and tear on your cartilage, old injuries that decide to make a comeback, a little extra body weight, which puts a ton of stress on your joints, weak muscles around the knee that just aren't giving it the support it needs, and finally, just plain old bad posture and movement habits.
And check this out. This number is kind of wild. For every single pound of body weight you have, your knees feel about 4 pounds of pressure every time you take a step. Just think about that. Losing just 5 pounds takes 20 pounds of pressure off your knees. Can you imagine the relief?
So, knowing what causes the pain is great, but the real question is, what can you do about it, like right now? Let's get into your first line of defense. Simple, powerful steps you can start taking today, right from your own home.
When your knee is screaming, the first thing you have to do is listen. Give it a rest from whatever is making it angry. Then, a good rule of thumb is ice is for calming things down, and heat is for getting things moving. So you'll want to use ice first to knock down that initial swelling, and then after a few days, you can switch to heat to help improve blood flow and loosen everything up.
And this is so important. Movement is your friend, not your enemy. You just have to pick the right kind of movement. Think of short, slow walks as a fantastic starting point. Swimming, that's like giving your knees a zero-gravity vacation. And gentle stretching or yoga, well, that's basically a spa day for your joints.
Okay, but what if you've tried the at-home stuff and that nagging pain is just sticking around? Hey, don't worry. There's a whole other level of advanced treatments out there that can make a huge difference. Let's look at some of the really exciting options.
You can think of injection therapy as being like a special forces mission for your knee pain. Instead of taking a pill that has to go through your entire body, this approach delivers a really concentrated dose of relief right to the source of the problem. It's incredibly targeted.
Now let's break down the big 3, because this is really cool. First, you have PRP, which uses your own blood to help repair damaged tissue. It's like a jumpstart for natural healing. Then you've got steroid injections, which are like the firefighters rushing in to put out the flames of severe swelling and pain. And finally, there's hyaluronic acid, which is basically like an oil change for your knee, helping everything move smoothly.
But hey, it's not just about what a doctor can do for you. Your body has this incredible, innate ability to heal, and taking a more holistic approach can really help unlock that power. This is all about the other therapies that can support and even supercharge your recovery. Seriously, think of your dinner plate as your secret weapon. You can fight inflammation from the inside out by loading up on delicious foods like salmon and walnuts, which are packed with omega-3s. Eat a whole rainbow of fruits and veggies. Think berries and broccoli that are bursting with antioxidants. And don't forget about turmeric. That golden spice is a powerhouse anti-inflammatory.
And remember, you don't have to do this all alone. There's a whole team of pros who can help. A good massage therapist can work wonders on tight muscles. An acupuncturist can tap into your body's own natural painkillers. And a chiropractor can help make sure your whole body is in alignment, which can take a ton of hidden pressure off your knees.
You want to know the real secret to long-term relief? It's not about one single treatment. It's about the little things you do every single day. So let's talk about building a strong foundation of healthy habits that'll protect your knees for years and years.
These are those small things that, honestly, make a huge difference. Think about it. Your shoes are the foundation of your body. Good posture is like having a strong frame. And getting enough sleep, that's when your body's repair crew gets to work. Oh, and that little pillow between your knees when you sleep on your side, it's a total game changer for keeping your hips and knees aligned. Okay, We've talked a lot about things you can do yourself, but it is just as crucial to know when it's time to call in the professionals. This last part is all about recognizing those red flags that are telling you, hey, it's time to see a doctor.
So just take a second, take a deep breath, and ask yourself this question honestly, because knowing the answer could really change everything.
So here's your checklist. If your knee is really swollen or turning red, if you have a fever along with the pain, if you literally can't put weight on your leg, or if your knee just feels wobbly, like it's going to give out, you need to make that call. And of course, if the pain just isn't getting any better after a few weeks of trying things at home, don't just tough it out. Go get it checked out.
You got to remember, healing takes time. It's not a sprint. You might start feeling better in a couple of weeks, and that's awesome, but the real, lasting changes happen over months. So just be patient with yourself, be consistent, and celebrate those small wins along the way.
And that's really the core message here, isn't it? It's not about finding some single magic pill. It's about building a bridge to a life with less pain, one small, consistent, daily step at a time.
So as we wrap this up, I want to leave you with a little challenge. Don't try to overhaul your entire life tomorrow. Just pick one thing. What's one small habit you can start today to give your knees a little bit of love? Your journey to feeling better starts right now.